I want to give you a brief overview of just some highlights from what you can expect to see in the plan. It's divided into 8 sections, so I will just go through and address it section by section, and like I said, just the highlights, and then we'll have an opportunity for your comments and questions. There was a sign-up sheet outside if you want to stand up and make a comment. If you'll just sign in on that sheet, and then I'll call you up. And we're having this recorded, and we will have it transcribed so that I can then have a record of the comments that are made, and we can evaluate those and consider meaningful ways to incorporate your comments and concerns into the plan and also into our policy. That comment period, we'd like for everyone to respect a 5-minute time limit so that there's an opportunity for everyone to comment. And then we will follow that up with an opportunity for questions and answers. So if you have a question, you'll see that there are index cards scattered about. You are welcome to write your question down and just pass it down to the end of the row. Dana and Amanda will pick those up in a minute. And then at the end, I've got a couple of announcements. So that's the nature of what we're going to do today. My thinking right now is once we gather the comments, I don't know how many we will have, and I don't know what your concerns will be, but we also wanted you to have some time over the next couple of weeks to make comments by email. And so that gives you an opportunity to really read the plan carefully. Like I said, the one thing you have to keep in mind is I already know of one inconsistency in the plan, and I'll address that as we go through the sections. But it's not entirely accurate yet. A couple of things to remember about a state plan that we file with the feds. Number one, for the first time ever, this plan covers a 3-year span. So it's the plan for 2019 through 2021. That's a really long time in the life of a program and an agency. And one of the things I've said repeatedly to my staff is, particularly when we thought we would have to have this filed on July 1, is that this is an organic document. This is a living, working document for a program that is living and working and evolving. And it should change over time. That's why the federal, the OCC has built in an amendment mechanism. So it should and will change. My anticipation when we were filing for July 1 was that we would go ahead and set up a schedule of quarterly evaluations of the plan. I think that we may be able to get it further along now with the August deadline so that we can probably evaluate it every 6 months. But it's already in my plan that we will just plan on making amendments. The other thing to remember is that it does not go into effect until October 1st of 2018. So if you see things in the plan and you say, that's not what's happening at DHS, I know that's not what's happening. No, it's not what's happening yet. But if it's inconsistent with how we are doing things now, you can expect a change in policy that will align itself with this state plan, and then you can expect a change in practice. But just remember that these changes, by and large, are not coming until October 1st. The first section basically just outlines the structure of leadership. Right now, I think we still have Dana Kidd listed as the administrator. We have actually hired a couple of women in our agency who are very talented and smart, and they have been working closely with me on developing this state plan. I'll introduce very quickly Amanda Fontenot is here today. And Christy McHale couldn't be with us this week. She's out with her children, but they will be the faces of leadership that you will see going forward. I am strictly serving in an interim capacity, but I will continue to be involved with all of the programs just in more of a counseling or consulting role. I think one really important change that you should already know about, but it was one of the things that was so important to Dana and I when we got our hands on this program, that we realized it couldn't wait. We made a significant change to our eligibility policy, and that is already in effect. That became effective April 30th, I believe. We aligned our eligibility policies with much more closely with those of SNAP and TANF. You no longer have to have 2 bills that match your photo ID in order to be eligible for the program. We basically just tracked the requirements of the federal regulations. So if you have not seen that policy, I would encourage you to look at it. We are in the midst of, many of you know, we opened up the waiting list in February, and we have issued over 7,000 certificates in the last 3 months. It was a tremendous undertaking, and so I'm not, and that policy change did not take effect until April 30th. So there were some cases that were reviewed under the old eligibility policy, but I'm not going to tell you that we are perfectly implementing the new policy. So if you know or you hear of situations where you think that we haven't gotten that change completely implemented, we want some areas that we know we need to strengthen in our program is our outreach to homeless children. That is a big mandate in the current regs. Use of matching funds, I know that's an issue that a lot of people are very concerned about. We sent back some money, I believe it was from 2016. And those of us who were new to the program over this past year, Jacob Black, Dana, myself, it pained us greatly to send money back. And that's not going to happen again. We've lined up our matching funding. There are numerous resources for making that match. Carol Burnett's been very instrumental in helping us learn about some of the other opportunities out there, but we've initiated meetings with our other state agency partners over at the Department of Health. I see my folks from Department of Health over here, as well as Department of Education, and there are ways for us to utilize each other's monies for matching purposes. And we've already had those meetings and conversations and initiated those relationships. So I don't anticipate that we're going to be in the position again of sending back federal money just because we can't put up the match. Disaster preparedness is required for everyone, and we're continuing to work on strengthening that. Chad Allgood has worked with me over at the Department of Health on getting you individual provider checklists that will help you in ensuring that you have a plan, and we are working to strengthen our statewide plan as well. Consumer outreach is a really big deal to the feds, and it should be to us too. I think, sometimes we forget that we can do all this great work, but if we don't message it well and we don't get the word out to you, then it's really not helpful to you. So we are working to really beef up the accessibility and the user-friendliness of our website. That is the CCAC website. We are coordinating our website at MDHS in a way that you will clearly know to click on one button if you want to know about childcare, and all of the information will be in one place, which I think is a real improvement so that we don't end up with disparate information on 3 different sites. Section 3, some of the areas that we're updating currently is our tables for the state median income and co-payment rates. We're also evaluating our priority populations to ensure that we aren't necessarily negatively encouraging. We really want to serve poor working families. That's the primary goal of this program. And so sometimes, we've got a lot of priority populations in our program, and we are evaluating now to determine if there's a way to streamline that. So we are making sure that the emphasis is on getting the certificates to those families who really need them the most. We will also be looking at underserved areas and considering ways that we might help generate new programming so that children can be served across Mississippi. One area in Section 3 that I noticed today that we are looking to change, one of the mandates from the federal government is that we fund programming in such a way that it creates a more predictable stream of income for providers. So that it's not so much based on, if a child shows up today or doesn't show up the next day, you can't really budget very well like that. So what I've proposed to do, the federal regs actually give a couple of examples of ways to count absenteeism so that it doesn't create that kind of unsteady, unpredictable income. And one is just, the simplest way to me is just to have a 5-day-a-month maximum. If you miss 5 days a month, we pay you the same no matter what. It's not considered excessive, and we don't want to know and don't want to keep up with whether they're sick, whether they're on vacation, whether... So that's my proposal. It didn't make it into the translation in Section 4, so that's something we have to go back and modify. But the plan is to go forward with the 5-day max absentee policy. That is something you're welcome to make comment on anything, but if you have other suggestions for ways to simplify that, we're open to your comments. Not much is slated to change about the nature of center-based child care. As you know, licensure is handled through the Department of Health. Most of that is statutory and set in regs. One thing that will change is that we have a duty to provide different types of care so that parents have choice about the type of care they put their child into. What we've been calling in-home providers in the past is actually called family child care by the federal government in the regs. So we will be calling, I'm going to amend a lot of our language to track the federal language so that it's easier for us to keep up with what we're talking about. But that's that old in-home care, family child care. In our state, it's usually 5 or fewer children with one caregiver in a residential home. The thing that we'll have to change about that is that we have a duty to monitor those programs, and so the way we are going to do that is through a relationship with the Department of Health. And they already have a statute on the books that allows for a voluntary registration process with the Department of Health. We will require that if you are going to be a family child care provider in the CCPP program, in the subsidy program, that you would follow those voluntary registry requirements. That's being fleshed out somewhat. We've had a number of meetings about it, so certainly your comments and suggestions in that regard would be welcome. I think that most of you already know about the change in market rates. If you're a provider, has anybody not received a change in the checks you're getting? No, yes. Okay, good. That was supposed to be in effect June 1. I know it was a long time coming. I don't think I can possibly explain to you how complicated it was to get those rates implemented. I've spent many, many hours solving that problem. Dana has spent many, many hours solving that problem. We've worked together pretty tirelessly for that. So not much has changed about how the rates differentiate. It's based on age, based on how long you keep them, special needs. The health and safety standards are required for center-based and family child care. Health and safety trainings, we'll continue to offer those through the early child academies. We are working on ways to streamline that process and I promise you we will not end up in the situation where we have the difficulty tracking your health and safety to your employees' identity again in the future. We're aware that that was not a positive process for most people, and we are already working to around that. Nothing's really changed about inspections. Criminal background checks, that, this is one of the federal requirements that's not optional. They are going to extend our option for waiver for part of their requirements because no state can meet them yet. We don't have the national structure in place, but we will continue to have those 4 components that we require now. Section 6 is about professional development. As you know, the early child academies are a relatively new component. Building Blocks has just joined them and added to our team of coaches, and they are working in conjunction with Families First to add another group of coaches. So what we're looking to do is really beef up the number of people that we're able to send out to your centers and work one-on-one with you. We think that that is the most effective way to help you improve quality and to keep you in your center. We know that it's important that you not hop up and have to leave the center every week so that you can come meet some requirement. We also know that that's the best opportunity for really impacting the quality of care that we deliver in this state. We are working extensively and often right now to really refine that process. And I think that, what we will be able to produce for you by the time we publish this plan is a clear, defined picture of who provides what role in this program and who you can turn to when you need certain types of help. So I think you will see some improvement in our communication about that. Section 7 talks about continuous quality improvement. We do have the 2 levels of child care. The idea behind the standard child care is that what we wanted to do is basically raise the floor. To have and this is required in the federal regs that we meet certain levels of quality. This was our model for doing that. I think that there's been some confusion over the last year and a half of what the intent behind it is, and I'm going to take ownership for that. I wasn't the director at the time, and I really wasn't as involved with the program, but one thing you will never hear come out of my mouth is, I wasn't there then, so it's not my fault. It's probably not my fault, but I will take responsibility for it. I take ownership for that. The way we're moving forward with the standard designation is, we're not denying people, we're not cutting them out of care. Our goal is to wrap around those services, those coaching opportunities for technical assistance, and help you get to meet those basic minimum requirements for standard designation. So I think there's been a lot of fear out there that maybe what we're trying to do is eliminate child care providers. That is not the intent, and it is not the way we will be moving forward. And I think that you will continue to see that as we refine our professional development process and our coaching model. It's all fairly new, and so it takes time to implement organizational change like this in a way that's meaningful. So I thank you for your patience in that. We hope to have a pilot project in the next year for comprehensive. We don't have any comprehensive centers at this time. The proposed rates that we put out for comprehensive are strictly that. They are proposed, and we will try them in a pilot program and use that opportunity to evaluate if that is an adequate rate for what we're looking for. Program integrity. This section of the plan still has some development to go. I'm really working hard within our agency to improve our program integrity process. We need to refine our administrative review policy. You need to know exactly what is expected if we find that you're not compliant with something, you need to know the way that you would go about appealing that decision or presenting us with more evidence. And so that part's coming. We know that that's a necessary part of the plan that we really need to develop and that we also need to reflect in our policies. Finally, we're at the comments section. And I just want to emphasize to you that we need your help. You're the experts out in the field. You know what's going on with children. Some of your advocates, you've been in this business a really long time. You know more about this federal program and its history and the state program than I could possibly have learned in the past year. Many of you have come to me and you've offered your help, and you've been there to give me guidance, feedback, critique, and I welcome all of it. So without taking up any more of your time, I would like to open the floor for comments, but I would also like to point out that you may submit comments to this email address, ccdfcomments@mdhs.ms.gov. Dana and I will be evaluating, we'll be monitoring that email address. And you're welcome to submit up until July 15th. You can submit comments at any time on that email address, but we can't guarantee that we can evaluate and incorporate them into the plan after the 15th. I don't have a date yet when I will post the final draft or when the next hearing will be. Kind of depends on how many comments I get. To me, one of the fundamental themes of this job is trying to strike balance. And that balance is not easy to achieve, but it doesn't mean it's unachievable. And I think often we fail by just going to the easy, quick answer rather than and scrapping something because it didn't have an easy answer. I like solving a puzzle. This is a big puzzle. And so I would just say, first of all, I really appreciate your candor today. I appreciate the respect and the demeanor with which everyone came here. I appreciate that you came willing to have a conversation. And I hope that you recognize that I'm willing to listen. I'll give you my cell phone number. I can't speak to, I don't know that I can give out other people's email addresses and cell phone numbers, but I want you to know that I'm accessible, and so is Dana Kidd, and that our staff will be accessible to you. We have a lot to do. We have done a lot. And so I just want to thank you for coming and being willing to hear today and being willing to speak. Again, does anyone have anything else? I will be posting the date of the final hearing and the plan prior to the final hearing. So thank you again for your participation. And thank you for what you do in CHOP.
Sometimes.